For people too that maybe don't know your background, talk to me a little bit about how you got to where you are right now with this charge.
Yeah, prior to working with Tennessee Stands, I was working for another family policy organization here in Tennessee. So involved in running that nonprofit, begun to get involved in the legislative process, seeing how the sausage is made, so to speak, behind the scenes. And while I was in that public policy role, COVID hit. And so in July of 2020, we started Tennessee Stands as an effort to support legislation and give a voice to people who were fighting for individual liberties here in the state of Tennessee and for limited government. So that's what we do.
If you could look at the whole picture, what is the most frustrating or disheartening thing that you think when you look at America right now where we stand in this pandemic?
There's a lot. I would say probably the most frustrating thing is I feel like we're unable to have a conversation. I feel like people in general are unable to feel like they can ascertain the truth. There is a significant loss of trust in institutions like our healthcare institutions that we should, as Americans and as people in general, we innately want to trust. We need to trust them, I will tell you. We need to be able to trust those folks. But right now, I think the general sentiment is there's a significant amount of distrust because of the conflicting information that continues to come out, the shifting information, the shifting goalpost that comes from not only the healthcare industry itself, but our elected officials. And so that to me, that's the most frustrating thing is I think people just feel lost and helpless in being able to know, I want to be responsible. I want to do the right thing, but I want to be able to make those decisions based on what I feel is the truth. What is the correct information? And I don't think most people feel as if we can find what is the correct information right now. It's a really hard place for us to be as a nation.
Do you think that lack of ability to get the information is because the healthcare system truly doesn't know, or do you think it's being manipulated? The narrative is being manipulated for political gain.
The latter, no question. Over the past decade and a half, 2 decades, everything in America has been. People say, well, this isn't political. No, you're missing it. Everything is political. Every conversation we have now is couched towards a political ideology. And if you don't align with such and such political ideology in a certain circle, you're canceled. You lose your business. You lose your influence. You lose your ability to generate an income for your family. You lose those things now if you don't toe the line of whatever it is ideology that you're supposed to support. That's it. Everything right now in America is political, and it's a shame. We're not trying to have political conversations. We're trying to have conversations about what is the truth, how does government work, how should it work, how should people expect their government to work. That is completely irrespective of any political ideologies or social ideologies you might subscribe to. As Americans, how do we collectively expect our government to work? Even that very basic thing is incredibly broken in America.
Does that frustrate you? Because there is a living document that clearly outlines the way in which our democracy is supposed to operate.
Yeah, which I'm not sure we all believe that anymore. And that's not new, right? This has been going on for a long time. Back in the early 1900s, President Woodrow Wilson was one of the first to publicly acknowledge in his view that the Constitution was somehow a living document, and that we were going to enter into a new era where we didn't have to be so strapped down to the foundations of how our founders thought government worked. And so that ushered in a wave of thought that I think probably had always been there. I love the verse from Ecclesiastes where Solomon says, there's nothing new under the sun. As human beings, we've been through this before, right? And here we are in America trying to rediscover and reinvent who we are, and the Constitution's just left fluttering in the wind. So it's That's unnerving whenever you really don't, I think, in today's world, have a foundation that you can draw upon. There are groups of people trying to draw upon that foundation, and then there are groups of people trying to completely ignore it. It's hard.
Well, then liken that to how we should be doing it and applying that principle today.
Right. Well, so same thing with all these mandates. Well, no, the government said this. Well, your employer said this. Well, this guy said this. We're losing what individual liberties are. We're losing the understanding of what the Constitution was written to protect. I look at what's happening with these mandates. To be honest, it's not all that different from what was going on in 1964, whenever we drafted the Civil Rights Act, whenever for the first time in America, we acknowledged in law that discriminating based on race, sex, religion was wrong. And that someone else, while we have freedom and liberty, someone else did not have the freedom or liberty to take yours away, right? And to deny the basis of your humanity and who you are. I think we're coming into a season now where law simply has not addressed the fact that, well, is bodily autonomy a thing? Is the right to make our own medical decisions a thing? Is our ability to choose what goes inside of our body, is that a basic human right? Is that something worth protecting? I would say emphatically yes. We've stepped towards that in the 1990s with the Americans with Disabilities Act, right? We made a step towards protecting those medical situations. But this is wholly and entirely different. And it's shocking that we've arrived at something in 2021 that law has not yet sufficiently addressed.
For those that believe the way you do, does it also scare you?
That is incredibly frightening. If you let that wash over you for a while, it will lead you to believe that we lost. It will lead you to believe that we can never go back to who we were. It would lead you to believe that there actually is a new normal. I will tell you, I reject the new normal, wholly and utterly. People need to wake up and realize that the conversation we're having right now is less about what you believe about society and what you believe about certain things, and more or less, do we accept that each other is a human being? Because we use the word dignity a lot. We have to respect, someone's dignity. We've really elevated dignity, which is interesting because we want to respect someone's dignity in one sense, but not in all senses. See, that only matters whenever that word dignity aligns with my specific ideology, we're good. But whenever it breaks, well, then that dignity conversation sort of goes away. Because it's someone who is unvaccinated now, in someone else's eyes, well, they have no more dignity because they're evil. And it's not that they're unvaccinated because they're making a personal medical decision, because they don't feel like they have all the information. No, that's not why they're making the decision according to these people. It's because they don't care about others. It's because they're un-American and they want other people to die, and they're selfish and they care more about themselves than others. So they don't deserve me to respect their dignity and their humanity. That's incredibly dangerous, because if we continue on that path, well, what's the next situation that now we don't have to respect this person for anymore? Right now, it's whether or not you're vaccinated or whether or not you wear a mask. That literally is defining who you are now in America. Well, what's the next basis of discrimination? What's the next thing? That's the scary part.
Would you classify those that feel this way as anti-vaxxers? Because I've received a lot of emails that use that term very broadly, that those that aren't getting a vaccine are anti-vaxxers. Right. Are you an anti-vaxxer?
I'm a skeptic, but I'm a skeptic about everything. I want to know the deep, dark things that people often try so hard to hide. Those are the things I want to know, whether or not it has anything to do with the vaccine. So the word anti-vaxxer to me is a word that's being used. It's almost like throwing around the word, well, they're a conspiracy theorist. Well, it's the same thing because now you've just minimized what they think, right? You've demonized them to some degree. So no, I'm not an anti-vaxxer. I think vaccines historically have done some really good things, obviously. I mean, people bring up smallpox and polio and things that, like, yes, clearly vaccines have made a difference in our society, but I would ask a further question. Does that mean that every vaccine is the same? I mean, how many vaccines do we have now? And are they all the same? Because one vaccine did something for one disease, does that now logically conclude that all vaccines will now cure all diseases? By the way, no matter or not if it's FDA approved, and disregard how much testing's been done. Disregard that one vaccine may have been tested for decades, and that one vaccine has been tested for months. We're supposed to now trust that, well, it's apples and apples. They're the same. They all do. No, so whenever someone says that, well, that makes me an anti-vaxxer because maybe I doubt the efficacy of one vaccine. That doesn't mean that I doubt the efficacy of all vaccines. I just think we need to be much more informed about what is happening around us. And back to your earlier question, it's scary that we're not supposed to question those things. And if you do, you're demonized, you're un-American, you're a hateful, selfish person.
Will you feel better 10 years from now looking at documentation, or 5 years from now, to see how the vaccine affects people? What is it? That's
100%. If 10 years from now you could look back on a series of trials and tests and whatnot and see, well, now for a decade you can acknowledge, well, what are the long-term effects of this vaccine? Well, you can see it in plain. What are the effects on our children? Same thing with masks. Honestly, we've never in America ever masked a population like this. It's never been studied. Are there long-term effects? I don't know. Are there long-term emotional effects, especially when you're slapping a mask on a child that's 5 years old in a situation where they're learning their emotional and verbal cues by looking at someone? Is that causing emotional long-term damage? I don't know. We've never done this before. It's those types of questions that we need to be asking more, and I wish that in America right now we could simply be having that conversation. That's what needs to happen.
With knowing, because we were talking about, 650,000 plus people have died, like what part of the responsibility do we have to try to snuff out a virus that is killing people? Like, where do we go from here?
So I think the medical community and people and their physicians, research, data analysts, laboratory technicians, we all have a responsibility to each other to do whatever we can to figure out what's going on and fix it, no question. Does government have a responsibility to mandate those actions? Does government have a responsibility to pick the winner? Look, does government have a right and a responsibility to pick the winners and losers out of the medical community? Well, we're going to promote your vaccine. We're going to downplay your vaccine. Well, why? Where's that data coming from? Where's the analysis that gives the government a right to determine which now medical product it's going to push onto the population? And by the way, spend your tax dollars to promote to you, telling you it's safe and effective. Based on what? That's the problem.
In getting everyone vaccinated, what is the political agenda that you think behind it?
At the end of the day, I believe, my personal opinion, this is a political agenda for control. Okay? We said this as soon as the mask mandates came out. I came out and said on our media that this was only compliance training for vaccine mandates. We said that right up front. Hear me now. They want you to wear a mask everywhere you go, and they are shaming you when you don't comply. This is a compliance training ground because the vaccine is coming and the mandates are coming and you must comply, okay? But before the health care crisis, it was the climate crisis. I mean, you remember this, right? So every year the world's going to end. What was the last one we heard in 12 years, right? AOC's 12 years. Why we need the Green New Deal, because if you don't hand over all of this control to the government, if you don't let us fix this, if you don't relinquish your liberty, you're going to die. The world is going to end in 12 years. Well, people for decades now, they're just not buying the climate change argument. They're just not. In general. At least, let me not say they're not buying the argument. It's not producing the change they wanted to see. The climate change scare is not equating to people being willing to relinquish their businesses and their liberties to the government. Well, gosh, if climate's not going to do it, maybe if we tell people they're going to die because they're sick, right? So let's move away from the climate. Let's go to a public health crisis. Well, now we've got them because people don't want to die. Rightly so. That's a natural instinct. So gosh, can the government provide an alternative? Can the government save me? Well, let's see what the government can do, because no one else is here to help me. This is political control. Again, I said earlier, Ecclesiastes, nothing new under the sun. Let's just take a walk back through history. This has all happened before. This is cyclical. Mm-hmm. This is cyclical, that populations get nervous, whether it's, war. Okay, well, gosh, let's lock everything down because, Russia's going to kill us and we need America to save us. Gosh, the world's going to end. Let's make the EPA king. Let's shut down industry. Oh gosh, we're all going to die from this virus. This has always been about let's give the government more control and relinquish our own.
Do you think the founding fathers would be upset, saddened, or do you think they too had that underlying current?
In what sense?
We talk about we represent the people. We're here for the people. We want to be amongst you. You elect us to be your voice. Mm-hmm. Were they true to that narrative, or was that something that we have thought and taught throughout?
I think so. I think the founders believed what they put on paper. I mean, my gosh, you go to the Declaration and they pledged their lives, their fortunes, and their sacred honor, to the very end.
So what has happened?
Well, I will say this, though. There's something else the founders understood about men, which is very, very important to why our government is structured the way that it is. Our government is structured in such a way that we should never, and I mean never, lose the idea of separation of powers. That is why we have fought so hard with Tennessee Stands against these executive orders and this emergency status and these mandates coming from one man, from our governor. Not because the governor is some evil guy, not because the governor is doing really anything different than a lot of other governors have done throughout the country. It's the sense that this is a clear break in separation of powers where legislative functions have now been transferred to one man. The emergency doesn't matter in that sense. There's no room in the Constitution for that to ever happen. That doesn't mean that as a people we don't need to address the emergency. It just means that it doesn't give one man the power to make law. Okay? And here's why our founders believed that separation of powers was so important. There were Federalist Papers written from 1787 to 1789. These were the papers that Alexander Hamilton, John Jay, and James Madison were writing up to the Constitution. They were making the case of why we need a Constitution, why we need a federal government. Why is this important? In Federalist 6, Alexander Hamilton said this about men. He said that men were ambitious, vindictive, and rapacious. Now that's very different from the modern view of man. The modern view is, men are inherently good. We're just all good people. And if you put us in the right circumstances, we'll just make the best decisions. No, we won't. Men are stupid. We have done stupid things throughout the entirety of our existence here on planet Earth. And we try to steal from each other. We try to take from each other. It's why law is so important. It's why we need order, so that we can all have liberty and we don't allow these ambitious, vindictive, rapacious men to take our liberty. So our founders knew that men left to their own devices, it would all go wrong. We've lost that basis of understanding. If you believe that men are good and men will treat you well, well then yeah, you have no problem with a governor being a king. The founders would have said, no, don't ever do that. If the world is burning down around you, that's never the right thing to do, to give all power to one man. I promise you, at some point, this will go terribly wrong for you. We've lost that. We don't understand who we are as people anymore.
So then how do we work through this so that more people don't die? More of our fellow Americans don't get sick? What's our individual responsibility in this?
We need the truth, don't we? We need to stop demonizing each other so that we can actually have the conversations that are necessary to ascertain what actually needs to happen to treat people that have this disease. I'm having personal experience now. It's interesting, in 2020, whenever the pandemic started, I knew no one personally that had COVID. Nobody. Now, in this second wave, if that's what we're calling it here in America, I've got personal friends that have ended up in the hospital struggling with, you've got COVID and they have, a lot of people get what's called double pneumonia. I've had several close friends now, young friends. Guy who was 36 years old just died in Wilson County with a young family, 3 kids. Not only 36, but healthy, strong. So we know there's a problem. But is the vaccine the only answer? Is a vent the only answer? Is remdesivir, which is what they want to push at this hospital, is that the only answer? Are there not other medications that are being given around the world in very early stages that are not only preventative, but curing people way before there's ever a need to even think about a ventilator? The truth is that is happening all around the world, and we're not having a conversation. And you won't find the conversation in the media. Google won't allow the videos to propagate, on a web search. YouTube won't allow the videos on their platform. And people are dying. And they're not dying from COVID, because COVID is preventable and it's treatable. That's what I believe. That's what many doctors are telling me that I'm very closely acquainted with. I would say that people are not dying as much from COVID as they're dying from not having access to the proper care, because we're not willing to have the conversation. And the people treating these patients that want to give them this kind of care, by the way, do you know how many doctors, can I say the word ivermectin, or is that a bad word? Am I going to get kicked out of Davidson County because I said the word ivermectin? I will tell you, there are so many doctors that I know personally that want to prescribe ivermectin. The patient wants ivermectin, and either the pharmacy will not fill it or the hospital will not provide it. And it's wrong. And the question is, why? I'm not a medical professional. I don't know.
You think follow the money and follow the politics?
Sure, 100%.
And you'll find the answer.
Always. That is always the answer. It's been the answer since our founding. It was the answer before America was founded. It's the answer today.
Are we going to be able to recover from this?
I hope so. I hope so. If we don't, I'm going to die trying. I can't ever allow myself. I've been married to my wife for 23 years, and we have 3 gorgeous little boys. And I can't imagine allowing myself to believe that I'm not able to hand down to them the chance to succeed, the chance to have a family, the opportunity to pursue their dreams. I can't let myself believe that. So we keep fighting.
Anything else you would want to say?
If I were to say anything else, I would plead with our legislators. We need our legislators to step up. We need our Tennessee General Assembly to step up and do the work that they are constitutionally prescribed to do, and that is to preserve liberty for individuals in this state. We are believing this lie, even amongst conservatives, that there are business rights and there are individual rights. The truth is that they're both the same. Businesses are individuals. Some individuals own businesses. Some individuals work for businesses. They're both individuals. And the General Assembly's job is to preserve as much liberty as we can to both parties. The idea that we pick a winner or we pick a business, the idea that being business friendly is letting a business owner do whatever it is they want to do, we're not having the right conversations. No one has the right to do whatever it is they want to do. It's why we have law. We must remember that, all law, I'm a liberty guy. I love liberty. I want all the liberty I can get. But I also acknowledge that if everyone has ultimate amounts of liberty, there's no law. At some point, guess what happens? My liberty and your liberty collide. And now we have a problem. Now neither one of us can enjoy liberty because our liberty is hitting a wall. This is why we have law. And our legislature needs to step up and recognize that there is one group of people, employees, that for whatever personal reason it is, whether it's, some people have legitimate health, not just fear of the vaccine, health reasons why they cannot have this vaccine. Yet employers are not recognizing this at all, and they're losing their job. And the conversation amongst conservatives even is, well, they can just go get another job. Well, where? I will tell you, there's quite a few employers that are making these mandates. So it's becoming harder and harder to find a job. The other side that believes this ideological point will say, well, good for them. That's good for them. Because these horrible unvaccinated people. That's the danger of where we're in right now as a society. If our legislature does not step up and address this with law, if we do not protect individuals from being discriminated, from being completely shut out of entire segments of our economy, this is going to go very, very bad. And it's going to not only be bad for people, it's going to be really bad for Tennessee. And so I would urge legislators to really think hard about what is upon us. Not just the tyranny coming from the federal government, but the tyranny that people are under every day who have lost their ability to make very simple decisions that 10 years ago we would have never dreamed that someone did not have the right to make. Yet here we are today, and we don't have the right to make those decisions anymore, or we lose our ability to feed our family. It's incredibly dangerous, and it will persist and it will continue out of fear.
As long as it's allowed to.
As long as it's allowed to.
Mm-hmm.
Because according to Alexander Hamilton, this is what men do. We must have law to protect these liberties.
And you're comfortable with me saying for you this issue is less about vaccine and more about civil liberty?
Yeah, 100%.
Okay.
This is a liberty conversation. This is a how does government work? How should we treat each other? How do we look at each other conversation?
And I think it's also fair for me to say, if given all of the information and you felt comfortable, you would be okay to get a vaccine if you felt the information was there to support.
Yes.
Okay.
Without question.